Removal of a cyst can be quite a difficult clinical procedure without some sort of guidance. I'm going to now present to you a case scenario of a 63-year-old gentleman who was looking to have 5 to 6 implants placed in his maxilla to replace his full upper denture. However, the clinical complication that we did have is he had a cyst in a critical area where we wanted to place an implant. If we want to place that implant there, we need to maintain as much bone as possible. And in order to do that, we need to guide the surgery so we limit the loss of bone. In order to guide the surgery, we need to make a diagnostic guide. We can see here, this is a digital representation of the guide. It's a copy of the patient's current denture that then has a guide there for the oral surgeon to drill directly into the bone. This minimises bone loss and also makes the surgery quicker. This was designed on a program called Implant Studio. What this program allows us to do is integrate a CBCT of the patient's maxilla and also a CBCT file of the patient's denture. What happened was that this patient had a scan of his maxilla, we can see here, and then the denture itself was scanned separately. That allows us to integrate these two images together. Then with the help of the oral surgeon, we diagnosed exactly where the cyst was and we virtually placed an implant. What that does is it allows us a path of insertion. We can also see it here and down here for us to drill into the maxilla, remove the cyst and then close it up. We can see on this slide a printed guide. This is post-cutting all the strengtheners off from building, and this is in a very specific material that's used for surgery. Once this material is printed, we can see it looks this sort of greeny colour. Then we cure it under a UV light for 10 minutes. We then finish it, we give it a trim and a polish. We place any surgical guide pins in there, we can see. And then once it's sterilised, it goes a clear colour as well. Really great material. This way, the technician and the surgeon can tell if it's ready for surgery. Here we can see the guide just prior to surgery. What we've done is we've cut an area out of the palate so the surgeon can raise a flap. Then we've placed a metal housing in there which guides the drill. During the surgery, firstly, the surgeon will raise a flap. Then they need to drill into the bone to remove the cyst. In order to do this accurately, before they've drilled into the bone, they place the surgical guide in place, and this allows them to drill a specific hole on a specific angle to minimize bone loss and also allow the patient to heal quicker. There are many other uses for these sorts of guide. An apicectomy is a good example. This is where an endodontist removes one of the roots of a tooth. Usually because that root can't be saved, but the tooth can. Normally, this sort of procedure is lengthy. It requires multiple x-rays and a long wait in the chair for the patient. With a guide, this procedure is simplified. What it involves is we take a model, we digitize that, then we grab a CBCT and we then make a guide over the model. We put a drilling cylinder into that specific to where this root's being removed, and then the surgeon can use this to drill directly to where the root of the tooth is. Another example is a surgical extraction guide. These guides also rely on the same sort of technology. We can see an intraoral scan here. We can see the extranumerary tooth that this patient has. Normally it would be quite difficult to extract this tooth because there's a lot of teeth and nerves beside it. However, with the use of a guide, we can plot a specific path of extraction. We can see it here, and we can drill into the bone exactly where we want. This increases patient outcomes and also makes the surgery a lot less time.